Baby boomers make up nearly 30% of the U.S. population, and over the next 10 years, it's expected that each day 10,000 baby boomers will hit retirement age. This means millions of people will head into retirement, collect Social Security, and potentially require varying degrees of medical assistance. Unfortunately, in some of these cases, the families of these seniors are unexpectedly burdened with the hefty costs of medical care.
So one of the things we see is that a lot of these families are sucking up massive amounts of their family's assets to take care of their aging parent in the last couple of years of their aging parent's life, because they just don't really know the programs that are out there that can help them. They're not really preparing and, not really doing the things that could help them avoid some of those types of scenarios.
That's Mark Dunning, a certified senior care manager and the director and founder of the Care Planning Institute in California. He's worked with hundreds of families nationwide to help create care plans for loved ones.
One of the biggest concerns that we see from families when they contact us is that they're just not aware that the government is not going to pay for the non-medical care services that most people need. Most people don't need skilled nursing home care, right? They don't need a registered nurse to be monitoring them. What they need is assistance with what we call activities of daily living, bathing, grooming, transporting themselves from A to B, even in their own home, getting from this room to that room, down the stairs, up the stairs.
The Care Planning Institute aims to help Americans navigate the various, sometimes complex, options for senior care and how to pay for it.
One of the things I realized as a home care agency owner is that a lot of people had no idea what care options were available to them after getting discharged from a hospital or a skilled nursing facility, and they certainly didn't know that Medicare wasn't going to pay for it. And how are they now going to get that paid for?
The U.S. Department of Health and Human Services estimates that 7 out of every 10 people will require some form of long-term care during their lifetime. So what can you do now to make sure you're prepared?
Most people are taking care of aging parents at some point, right? And they're seeing that, boy, we need to be paying for this out of our own pocket. I don't want to end up in this type of scenario myself, so they start looking for options. And one of those options, of course, is long-term care insurance. It's kind of like a life insurance policy, but it starts paying out when you need assistance with activities of daily living. And not all long-term care insurance policies are created equal. There's literally thousands of them out there. You really have to be careful with what you get signed up with. Here at Care Planning Institute, we can help people navigate some of those options and things to kind of watch out for. But overall, long-term care insurance is a great option for people. And the sooner you start paying into a policy, obviously, the lower your monthly premiums will be.
Dunning says long-term care insurance is a great option for funding senior care, but it only works if you plan ahead.
You can't start paying into a policy if you're already needing some help with those things. You can't just say, oh, my parent needs help with activities of daily living. Let's go get her signed up for a long-term care insurance policy. It's too late at that point, right? You have to sign up before you're, quote, sick and be paying into the policy.
Along with long-term care insurance, there's specific benefits for eligible United States military veterans and their spouses. For the general population, there's also Medicare and Medicaid, along with other resources. Medicare, however, typically only covers short-term health care costs and not long-term. Medicaid is a government program that helps low-income people with health care, but Dunning says it has its limitations.
A lot of seniors out there are receiving care through Medicaid and having Medicaid pay for the nursing home care. And a lot of those facilities are not getting reimbursed at a very high rate from Medicaid. So unfortunately, their resources are stretched a lot thinner than the nursing homes that are paid through Medicare. So, if you're looking to stay in a nursing home long term and having Medicaid pay for it, A, there's a huge waiting list to get into those nursing homes, and B, when you get in there, you really want to do your homework on that facility to make sure it's something that you'd want to be going into.
The cost of staying in a nursing home varies widely based on location and standard of care. But no matter which facility you're in, Dunning says the amount of one-on-one attention a patient gets from in-home care is incomparable to a nursing home.
One of the things that we really hear a lot about is just lack of care as far as attention to a person's needs in a nursing home. And that's really just because of how it's designed. When you're in a nursing home, many of those have one aide that roams 20-plus rooms, right? So you're getting a lot less attention, and so you could be you could end up soiling yourself or something like that and ring your bell and maybe not get help for a number of hours.
There are a number of options for senior care available, from assisted living communities to independent living to personalized in-home care. Out of all of these, 76% of adults would prefer to stay in their homes as long as possible and opt for in-home care, according to a 2018 AARP survey. However, the average national cost in 2019 for an in-home health aide isn't cheap, at $52,000 per year. Joy Demiar is an in-home caregiver full-time and has worked in the profession for nearly a decade. Her parents are both caregivers and taught her the trade from an early age.
I'm very fortunate with that, to see my parents working with their clients. Like I was able to shadow them for a long time, and I just gained this knowledge, and then now I just feel like I'm very confident with my job.
Demiar says that being a caregiver is a tough job, and many people don't realize just how indispensable the role is to millions of aging seniors.
The dementia client that I have worked before, I usually work with them 24-hour care. You make sure that in the morning before you wake them up, you have to prepare everything that you need for them. Like, make sure that the diaper is ready in the bathroom, the towels and the wipes, all those necessities that you need before you wake them up. And then when you wake them up in the morning, you have to be like really gentle and talk to them and say, for instance, I'm going to use this client that I have worked before. His name was Gabriel. So I would just go into the room and say, "Good morning, Gabriel. It's time to wake up, rise and shine." And, very gentle. Just you tell them the date. Today is Saturday, whatever the date is. And you make little conversations. And so while they're just trying to wake up, and then you tell them the routine, that this is what we're going to do. We need to you always have to be engaged. Like, you want to tell them what you're doing so you don't scare them.
Being in this role requires a lot of patience and understanding, and finding the right patient-caregiver fit is important. Home care is one of the fastest-growing occupations, with an additional 1 million workers needed by 2026, according to AARP. Despite the demand, there's a big shortage in the industry due to long hours, inconsistent schedules, and low wages. Demiar is an independent home care worker and says some weeks it can be tough to make ends meet.
Working with this client named Mrs. Keller, she had Parkinson's disease, and I had a lot of challenges working with this client. For instance, the job was really it was a low pay job with a very hard labor job. I was only getting $13 per hour and working 12 hours per day for 5 days a week.
Demiar, along with each person working within the senior care industry, is a vital piece in ensuring the welfare of millions of aging Americans. Demiar hopes that sharing her story will change how people view the industry and its workers.
When I tell them I'm a caregiver, they just make it seem like it's a low job. Like, you're a caregiver. It's more like you're a helper. When you're talking to someone and you kind of feel that vibe and someone's looking you down about this job. But really, the people should have that respect of the caregiver job, because they do pretty much everything for their families and for their loved ones.
To find out more about links and resources surrounding senior care and both of our guests, Mark Dunning and Joy Demiar, visit viewpointsradio.org. Also follow Viewpoints Radio on Twitter and Instagram for more behind the scenes. This segment is written and produced by Amira Zaveri. I'm Gary Price.
Holiday celebrations are often joyous occasions, but they can be challenging for the millions of people living with Alzheimer's disease and those who care for them. The hustle and bustle of the holidays can be stressful for those with Alzheimer's, and changes in the daily routine, large gatherings, and noisy environments can create extra anxiety. Monica Marino, Senior Director of Care and Support at the Alzheimer's Association, has some tips to make the holidays enjoyable.
First, plan ahead. Prepare the host for special needs, such as a quiet room for the person to rest. If you're hosting, let guests know what to expect before they arrive. Since crosstalk and multiple conversations can be challenging for people living with Alzheimer's, try engaging the person one-on-one or in smaller groups and keep them involved in the celebrations.
Marino also suggests experimenting with new traditions. For example, if evening confusion and agitation are a problem, turn your holiday dinner into a holiday lunch or brunch. Find out more tips at alz.org.
What are you going to do with your old car? You can try selling it, you could junk it, or you can donate it to Heritage for the Blind. Your car will be towed away for free, and your donation is tax deductible. Just call 1-800-835-1478. Heritage for the Blind accepts cars, vans, trucks, and boats. It doesn't matter if your vehicle runs or not. It will be towed away for free, and you'll be supporting those that need help. Heritage for the Blind is a nonprofit organization that helps the visually impaired live fuller lives. Call right now to donate your car, and as a special thank you, you'll receive a free 3-day vacation voucher to over 50 locations. Call Heritage for the Blind right now. Call 1-800-835-1478. Donating is easy, and your vehicle is towed away for free. Plus, you'll get a free vacation voucher for donating. Call now, 1-800-835-1478. That's 1-800-835-1478.
And that's Viewpoints for this week. Viewpoints is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more about upcoming shows. And find a library of past programs on Apple Podcasts, Google Play, and Spotify. Plus, you'll always find previous segments and more information about our guests at viewpointsradio.org. Join us again next week for another edition of Viewpoints. Coming up next week.
They wash the arm off with a little wine or spirits of wine. They stamp on the pattern, and then the tattoo artist goes to work with 2 steel needles.
What was it like to get a tattoo in the 16th century? Then,
the fact that everything's on social media nowadays, so you just got to make sure you're minding your P's and Q's.
Life-changing insights from a former professional football player. I'm Marty Peterson.
And I'm Gary Price. These stories in depth on your public affairs magazine, Viewpoints.